Question 1. In ICD-10-CM coding, which symbol indicates that additional characters are required to complete the code, such as a seventh character? A. Excludes 1 note. B. Excludes 2 note. C. Placeholder character, X. D. Dash-hyphen symbol at the end of a code. Answer: D. Dash-hyphen symbol at the end of a code. This question tests understanding of ICD-10-CM code structure and conventions. A dash at the end of a code in the alphabetic index or tabular list is a crucial clue indicating that the code is incomplete and requires additional characters, often to provide greater specificity or laterality. For example, if the index lists a condition code ending in a dash, you must refer to the tabular list to find the full, valid code, which might require a fourth, fifth, or even a seventh character. Always follow that dash to the tabular list to ensure you report the most complete and valid code possible. Question 2. What is the primary purpose of the ICD-10-CM official guidelines for coding and reporting? A. To provide diagnosis codes for all medical conditions. B. To offer guidance on how to properly assign ICD-10-CM codes. C. To list all procedures performed in a healthcare setting. D. To define medical terms used in diagnosis statements. Answer: B. To offer guidance on how to properly assign ICD-10-CM codes. Understanding the function of the official guidelines is fundamental for accurate coding. These guidelines serve as the authoritative rules for applying ICD-10-CM codes, ensuring consistency and compliance across all healthcare settings and types of encounters. They provide instructions on everything from sequencing codes to applying conventions and chapter-specific rules, acting as your essential rulebook for correct code assignment. Always consult the guidelines when unsure about how to apply a code to a specific patient encounter. Question 3. When coding for a patient seen in the outpatient setting, what should a coder do with a diagnosis listed as probable, suspected, or likely? A. Code the condition as if it exists. B. Code the signs or symptoms that led to the encounter. C. Ask the physician for clarification before assigning a code. D. Report a code indicating an uncertain diagnosis. Answer: B. Code the signs or symptoms that led to the encounter. This question highlights a key difference in coding for outpatient versus inpatient settings. In the outpatient setting, coders must not code diagnoses listed as uncertain, such as probable or suspected, but instead report the signs, symptoms, or abnormal test findings documented. For instance, if a patient is seen for chest pain likely due to a heart attack in the outpatient clinic, you would code the chest pain, not the heart attack. This guideline is crucial for ensuring code assignment reflects only documented, confirmed conditions in the outpatient setting. Question 4. A patient is admitted to the hospital with pneumonia and develops sepsis during the admission. How would the coder likely sequence these conditions as the principal diagnosis and secondary diagnosis? A. Sepsis first, then pneumonia. B. Pneumonia first, then sepsis. C. Either sepsis or pneumonia could be principal, depending on physician documentation. D. Code only the condition the patient was treated for first. Answer: A. Sepsis first, then pneumonia. This scenario involves a common coding guideline regarding conditions like sepsis that develop during a hospitalization. When sepsis is present on admission or develops during the encounter due to an underlying localized infection, such as pneumonia, the guideline typically dictates that sepsis is sequenced as the principal diagnosis followed by the underlying infection. This sequencing reflects the severity of the sepsis affecting the patient's overall condition. Always refer to the specific guidelines for sepsis coding to ensure proper sequencing based on the documentation. Question 5. In ICD-10-CM, what does the excludes 1 note signify? A. Not coded here. The condition excluded is not part of the condition represented by the code. B. Not included here. The condition excluded is not included in this code but may be coded elsewhere. C. Code also. The condition listed must be coded along with the current code. D. Use additional code. Another code may be needed to fully describe the condition. Answer: A. Not coded here. The condition excluded is not part of the condition represented by the code. Understanding the different exclusion notes is vital for accurate code selection. The Excludes 1 note indicates that the condition listed is completely separate from the condition represented by the code and should never be coded at the same time. For example, if a code describes one type of congenital anomaly, an Excludes 1 note might list another, indicating you cannot code both if present in the same patient. Always pay close attention to Excludes 1 notes to avoid assigning contradictory codes. Question 6. A patient is diagnosed with type 2 diabetes mellitus with diabetic nephropathy. How would this typically be coded? A. Code for type 2 diabetes only. B. Code for diabetic nephropathy only. C. Code for type 2 diabetes with a separate code for nephropathy. D. Use a combination code that includes both type 2 diabetes and nephropathy. Answer: D. Use a combination code that includes both type 2 diabetes and nephropathy. This question tests the use of combination codes, which are common in ICD-10-CM for conditions that frequently occur together or where one condition is a manifestation of another. Diabetes with complications like nephropathy is a classic example where a single code captures both the underlying condition, diabetes, and the associated complication, nephropathy. Using the specific combination code ensures accurate and complete reporting of the patient's complex condition. Look for codes titled with to identify these important combination codes. Question 7. What is the correct order when locating an ICD-10-CM code for a diagnosis? A. Begin in the tabular list, then verify in the alphabetic index. B. Begin in the alphabetic index, then verify in the tabular list. C. Code directly from the physician's documentation. D. Ask the physician which code to use. Answer: B. Begin in the alphabetic index, then verify in the tabular list. The fundamental process for finding an ICD-10-CM code always starts with the alphabetic index. You look up the main term for the patient's condition or symptom there to find the preliminary code assignment. Then, you must turn to the tabular list to verify that code, read all instructional notes, and assign the most specific code available, adding any necessary characters like laterality or seventh characters. Skipping the tabular list can easily lead to incorrect or incomplete code assignment. Question 8. A patient falls and sustains a fracture of the distal radius of the left arm. Which component of the ICD-10-CM code would typically specify which arm was injured? A. The first 3 characters. B. The 4th character. C. The 5th character. D. The 6th character. Answer: D. The 6th character. Laterality, indicating which side of the body is affected, left, right, or bilateral, is a crucial component for many ICD-10-CM codes, particularly those in the musculoskeletal and injury chapters. For fractures, the 6th character is commonly used to specify laterality. For instance, a code might have options for left, 1, right, 2, or unspecified, 0 or 9, in the 6th character position. Always look for laterality options in the tabular list to ensure precise coding. Question 9. Which ICD-10-CM chapter contains codes for factors influencing health status and contact with health services? A. Chapter 1, Certain Infectious and Parasitic Diseases. B. Chapter 18, Symptoms, Signs and Abnormal Clinical and Laboratory Findings, not elsewhere classified. C. Chapter 20, External Causes of Morbidity. D. Chapter 21, factors influencing health status and contact with health services. Answer D. Chapter 21, Factors Influencing Health Status and Contact with Health Services. Knowing the broad categories covered by the ICD-10-CM chapters helps navigate the code set efficiently. Chapter 21, often referred to as the Z codes, is specifically designated for circumstances other than a disease, injury, or external cause that influence a person's health status or contact with healthcare services. These codes are used for situations like routine physicals, history of certain conditions, or exposure to infectious diseases. Recognizing the scope of the Z codes helps identify when they are appropriate to report. Question 10. What is the purpose of a seventh character extension in ICD-10-CM? A. To indicate the anatomical site of the condition. B. To specify the cause of an injury. C. To provide information about the encounter, such as initial or subsequent care. D. To identify laterality, left or right. Answer C. To provide information about the encounter, such as initial or subsequent care. Seventh character extensions are a unique feature of certain ICD-10-CM chapters, particularly those covering injuries, obstetrics, and others. These characters provide important information about the episode of care for the condition being reported, such as whether the patient is receiving initial treatment, follow-up care, or is experiencing a sequela, late effect. Forgetting to add the required seventh character renders the code invalid, so always check the tabular list for sections requiring extensions. Question 11. An unspecified code should generally be avoided when coding a diagnosis because A. They are not valid for reporting. B. They indicate a lack of documentation specificity. C. They always require a seventh character. D. They only apply to certain body systems. Answer B. They indicate a lack of documentation specificity. While unspecified codes are valid ICD-10-CM codes, they are generally less precise and should be avoided when more detailed information is available in the patient's medical record. Using an unspecified code often signals that the documentation did not provide enough detail for a more specific code assignment. Aim to code to the highest level of specificity supported by the documentation to accurately reflect the patient's condition. Question 12. In the ICD-10-CM alphabetic index, what does the term C indicate? A. Another code that should be used in addition to the current code. B. A condition that is excluded from the current code. C. A mandatory cross-reference to another term where the correct code is found. D. A suggestion to check another term for additional coding options. Answer C. A mandatory cross-reference to another term where the correct code is found. Cross-references in the alphabetic index guide the coder to the correct main term. The C instruction is a mandatory direction, meaning you must stop looking under the current term and go to the term indicated to find the appropriate code. For example, if you look up a synonym for a condition and see C followed by another term, you must go to that second term to locate the code. Always follow the C instruction to ensure you are in the correct section of the index. Question 13. A patient presents with acute appendicitis. What is the main term you would look for in the ICD-10-CM alphabetic index? A. Acute. B. Appendicitis. C. Inflammation. D. Abdomen. Answer B. Appendicitis. When using the alphabetic index, the main term for a diagnosis is typically the condition itself, not an adjective describing it or the anatomical location. In this case, appendicitis is the core condition. Modifiers like acute would be found under the main term appendicitis as subterms. Start by finding the disease, injury, or condition in the index. Question 14. Which of the following would typically be coded using an ICD-10-CM Z code? A. Acute myocardial infarction. B. Fracture of the tibia. C. Encounter for routine well-child exam. D. Pneumonia. Answer: C. Encounter for routine well-child exam. Z codes are used to report factors influencing health status and contact with health services, not acute illnesses or injuries. A routine well-child exam is a perfect example of a healthcare encounter that is not for treating a specific illness but rather for preventative care and assessment of health status. This makes a Z code the appropriate choice to describe the reason for this visit. Think of Z codes as describing reasons for encounters other than active sickness or injury treatment. Question 15. When coding a chronic condition that has an acute exacerbation, how are the codes typically sequenced? A. Code the chronic condition first, then the acute exacerbation. B. Code the acute exacerbation first, then the chronic condition. C. Code only the acute exacerbation. D. Code only the chronic condition. Answer: B. Code the acute exacerbation first, then the chronic condition. For conditions that are both chronic and experiencing an acute worsening, exacerbation, the ICD-10-CM guidelines generally instruct you to code the acute exacerbation first, followed by the chronic condition. This sequencing reflects that the acute exacerbation is the primary reason for the encounter or hospitalization. For example, if a patient has chronic obstructive pulmonary disease, COPD, with an acute exacerbation, the code for the acute exacerbation of COPD would be listed first. Always check the specific guidelines for the condition in question, but this is a common rule. Question 16. What does the term sequela refer to in ICD-10-CM coding? A. An initial encounter for a new injury. B. An acute exacerbation of a chronic condition. C. A late effect or residual condition produced after the acute phase of an injury or illness has terminated. D. A complication that occurs during a medical procedure. Answer: C. A late effect or residual condition produced after the acute phase of an injury or illness has terminated. A sequela, also known as a late effect, is a condition that remains after the initial illness or injury has resolved. Coding a sequela requires two codes, one for the residual condition, the sequela, and one for the cause of the sequela. For example, paralysis resulting from a stroke is a sequela, requiring a code for the paralysis and a code indicating it was due to a stroke. Recognizing a sequela is key to assigning the necessary dual codes. Question 17. A patient presents with a pathological fracture of the femur due to metastatic bone cancer. How should this be coded? A. Code the fracture first, then the metastatic bone cancer. B. Code the metastatic bone cancer first, then the fracture. C. Code only the fracture as it is the current reason for the visit. D. Code only the metastatic bone cancer as it caused the fracture. Answer: B. Code the metastatic bone cancer first, then the fracture. When a fracture is caused by an underlying disease, such as osteoporosis or metastatic cancer, a pathological fracture, the guideline is to code the underlying disease as the principal diagnosis followed by the code for the pathological fracture. This sequencing reflects that the underlying disease is the root cause of the fracture, making it the primary condition influencing treatment. This is different from traumatic fractures, so recognizing the term pathological fracture is essential. Question 18. Which of the following conditions would require an external cause code? Codes from Chapter 20. A. Essential hypertension. B. Type 1 diabetes mellitus. C. Burn from accidental contact with a hot stove. D. Osteoarthritis of the knee. Answer: C. Burn from accidental contact with a hot stove. External cause codes provide information about how an injury occurred, the intent, accidental, intentional, etc., the place it occurred, and the activity the person was doing. They are supplementary codes used with injury codes. Essential hypertension, diabetes, and osteoarthritis are medical conditions coded from other chapters, not injuries caused by external circumstances like a burn from a hot object. Always consider adding an external cause code when reporting an injury. Question 19. What does the Excludes 2 note signify in ICD-10-CM? A. Not coded here. The condition excluded is not part of the condition represented by the code and should never be coded with it. B. Not included here. The condition excluded is not included in this code but may be coded elsewhere at the same time. C. Code also. The condition listed must be coded along with the current code. D. Use additional code. Another code may be needed to fully describe the condition. Answer: B. Not included here. The condition excluded is not included in this code but may be coded elsewhere at the same time. The Excludes 2 note indicates that the condition listed is not included within the code's definition, but it is permissible to code both the code from that section and the excluded condition if both are present. Think of Excludes 2 as can be coded with. For example, a code for one type of skin rash might have an Excludes 2 note for another type of rash, meaning the patient could have both simultaneously and you would code each one separately. It's less restrictive than an Excludes 1 note. Question 20. In the context of inpatient coding, what is the definition of the principal diagnosis? A. The diagnosis that is the most severe. B. The condition that is chiefly responsible for occasioning the admission of the patient to the hospital. C. All diagnoses treated during the hospital stay. D. The diagnosis listed first by the physician. Answer: B. The condition that is chiefly responsible for occasioning the admission of the patient to the hospital. Identifying the principal diagnosis correctly is critical for inpatient coding and billing. The principal diagnosis is not simply the most severe condition or the first one listed, but rather the condition determined after study to have been the reason the patient was admitted to the hospital. This requires careful review of the entire medical record to understand the focus of the patient's inpatient stay. It's the diagnosis that drove the need for hospitalization. Question 21. What does the term code first indicate in the ICD-10-CM tabular list? A. The code listed is the principal diagnosis and should always be sequenced first. B. The underlying condition should be coded first, followed by the code where the code first note appears. C. The condition listed in the code first note is a manifestation and should be coded second. D. The current code is the most specific code available for the condition. Answer: B. The underlying condition should be coded first, followed by the code where the code first note appears. The code first note is an important sequencing instruction indicating that the code where the note appears is a manifestation code, meaning it represents a symptom or complication of an underlying condition. You must code the underlying condition first, followed by the manifestation code. For instance, if a code for a neurological symptom has a code first note referring to diabetes, it means you must code the diabetes first, then the neurological symptom. Always follow code first notes precisely for correct sequencing. Question 22. A patient is diagnosed with a sprain of ligaments of the ankle. Which main term should you look up first in the alphabetic index? A. Sprain. B. Ligaments. C. Ankle. D. Injury. Answer: A. Sprain. Similar to finding a disease, the main term for an injury in the alphabetic index is typically the type of injury itself. In this case, sprain is the type of injury. Subterms would then lead you to the specific location, such as ankle, and potentially specify the ligaments involved. Start with the nature of the injury to navigate the index effectively. Question 23. What is the purpose of using the placeholder character X in some ICD-10-CM codes? A. To indicate an incomplete code that needs more characters. B. To reserve a character position for future code expansion. C. To signify that the code is for an external cause. D. To represent laterality when it is unspecified. Answer: B. To reserve a character position for future code expansion. The placeholder character X is used in ICD-10-CM codes of less than 6 characters that require a 7th character extension. The X fills in the empty character positions so the 7th character can be in the correct spot. For example, if a code is 4 characters long and needs a 7th character, 3 X's would be used in the 5th, 6th, and 7th positions before adding the actual 7th character. This ensures the structural integrity of the code. Question 24. When a patient has documentation of both an acute and a chronic condition, an ICD-10-CM provides separate codes for each, and the condition is not designated as an acute exacerbation of a chronic condition. How are they typically coded? A. Code only the acute condition. B. Code only the chronic condition. C. Code both conditions, sequencing the acute code first. D. Code both conditions, sequencing the chronic code first. Answer: C. Code both conditions, sequencing the acute code first. When separate codes exist for both the acute and chronic forms of the same condition, and both are present and treated during an encounter, ICD-10-CM guidelines generally instruct to code both, listing the acute code first. This applies unless otherwise specified by a specific guideline for that condition, like the acute exacerbation rule. For example, acute and chronic sinusitis would typically be coded with the acute sinusitis code first. Always verify with specific guidelines, but prioritizing the acute code is a common practice. Question 25. According to ICD-10-CM guidelines, when is it appropriate to code a sign or symptom? A. When a definitive diagnosis has been established. B. When a sign or symptom is routinely associated with a confirmed diagnosis. C. When no definitive diagnosis has been established by the provider. D. Only in the inpatient setting. Answer: C. When no definitive diagnosis has been established by the provider. Signs and symptom codes, from Chapter 18, are appropriate to report when the physician has not documented a specific diagnosis for the patient's condition. For instance, if a patient presents with fever but the cause is undiagnosed after the encounter, you would code the fever. However, if a definitive diagnosis, like pneumonia, is made that explains the fever, you would code the pneumonia and not the fever. Code signs and symptoms only when they are the reason for the encounter and no underlying diagnosis is made.